This video is going to be on lymphopenia, which is a decreased concentration of lymphocytes in blood. But before going into the causes of lymphopenia, I'll remind you that lymphocytes do recirculate between lymphoid tissue, blood, non-lymphoid tissue, and back to blood. So lymphopenia often occurs because this recirculation of lymphocytes is somehow interfered with. Okay, so the first cause of lymphopenia and the most common cause of lymphopenia is a stress lymphopenia. And this is due to too much cortisol or too much glucocorticoids. The most common cause of this is stress. Any sick animal can have a stress lymphopenia, but more specifically, adrenal or pituitary tumors can produce too much cortisol or ACTH, which causes a stress lymphopenia. And then, of course, if you were given the animal exogenous glucocorticoids, you could have this lymphopenia as well. Okay, so now to explain this lymphopenia, when there's excess glucocorticoids, the lymph nodes home to the lymph node. So they move from blood to the lymph node and from the tissues to the lymph node. And they do this because they're waiting for antigen presentation. They're assuming that some sort of infection is ensuing, so they're going to the lymph node to wait to receive antigen. They also get sequestered within the lymph node, so once they get there, they don't leave. And then finally, if there's chronic or very high doses of glucocorticoids, that can lead to lymphocyte lysis or lymphocyte cell death, known as lympholysis. All right, so that's stress lymphopenia. I'm going to reset this picture and move on to the second cause of lymphopenia, which is acute inflammation. And this can be inflammation due to any infectious or non-infectious cause. Acute infection or acute inflammation causes lymphopenia because, again, the lymph nodes home to the lymph node and they're just waiting there to be primed with some sort of antigen. And once they get there, they stay in the lymph node, so they're sequestered within the lymph node. And then finally, lymphocytes move from the blood into the area of inflammation within the tissue. Okay, so now I'm going to reset the picture again so that I can talk about the third cause of lymphopenia, which is lymph loss. And the two sites that animals can lose lymph is either the GI tract or into the pleural space, which is called a chylous effusion, where there's leakage of chyle into the pleural space. So first I'll talk about GI disease, and I'm going to change this tissue so that it's an intestine and make a lumen, the intestinal lumen over to the left. Any sort of GI disease where there's inflammation, that's kind of taking over the tissue, infiltrating the tissue, or if there's some sort of neoplastic disease too. In any case, the tissue is being infiltrated and essentially the lymphatic drainage is decreased because the lymphatic vessels are compressed, and that could cause leakage of those lymphatic vessels into the GI lumen. So you get loss of lots of lymphocytes and chyle into the lumen. The second cause of lymph loss would be repeated drainage of chylous effusions. Chylous effusions is when there's lymph leaking into a third space, leaking into the pleural space most commonly. So there's leakage, and then the lymphocytes move from the vessels into the pleural space. Now, under normal conditions, the lymphocytes would be resorbed and recirculate back into blood. But if you, as the clinician, were to drain that fluid off of the pleural cavity so that the animal can breathe and expand their lungs, then that lymph is lost from the body and you can get lymphocyte depletion. Okay, so now I'm going to reset the picture again so that I can talk about the last cause of lymphopenia, which is lymphoid hypoplasia or aplasia. Remember, hypoplasia is that the tissue did develop, but then decreased, and then aplasia is that it never developed in the first place. So the first cause of lymphoid hypoplasia is immunosuppressive drugs. So glucocorticoids, for example, or chemotherapeutic drugs where you're trying to treat the animal for cancer. And this actually causes cell death of the lymphocytes or lympholysis. The next cause of lymphoid hypoplasia would be a generalized lymphadenopathy. So multiple lymph nodes throughout the animal is effaced and replaced with a cell that should not be there. So a great example of this would be generalized lymphadenitis or inflammation of the lymph nodes. And this can happen with lots of different fungal infections, for example, or generalized lymphoma, multicentric lymphoma, where lymphoma is replacing and infiltrating all of the lymph nodes in the animal. So generalized lymphadenopathy, that's when the lymph nodes are replaced or lymphoid tissue is replaced by a cell type that should not be there. And then the last cause of lymphopenia that I'm going to go over is a congenital immune deficiency. And in this case, that causes aplasia, right? The lymphoid tissue fails to develop in a young animal. And fortunately, these are super rare, but a good example of that would be severe combined immunodeficiency or SCID. You may have heard of that as like the bubble boy syndrome. Okay, so that's it for lymphopenia. The 4 causes are stress, acute inflammation, lymph loss, and lymphoid hypoplasia or aplasia. Of those, stress is the most common because any animal that you see is going to be, well, any sick animal that you see is going to be stressed.